सारे मुद्दे आपने बोल दिए, कोई बात नहीं, कोई बात नहीं, ऐसे ही होता है.
In regarding the health, when we come to health, I am reminded of the words of Vivekananda, who said, in a modern society, people have to be well fed, well educated, and well looked after. Now here we are discussing about the third part, how the being well looked after. Here, when we go through the figures, we find that on an average per year, 3.1% of the GDP is spent on public health, of which 1.3% is spent by governmental agencies. And of this, only 0.25% is the share of the central government. So we find that it is only less than 1/16th of the total expenditure in health. This has to be changed. The 2015 NSSO report reveals that in the public hospital, government hospitals, only 11.5% of outpatients come there. The rest are depending on the private hospitals. Also, it shows that for an inpatient, on an average, in a government hospital, it is what is spent is rupees 6,120. In a private hospital, it is 25,280. It is more than 4 times in a private hospital compared to the government hospital. And we find that only less than 30% of the people seek the public health system. In such a situation, what we are doing is, we are handing over the responsibility of public health system, particularly the hospital treatment, to insurance. In the present budget, the Finance Minister has extended a project of spending 1 lakh rupees per family through medical insurance, which will be increased by 30,000 rupees in the case of senior citizens. But what happens is that if we take the experience of the NRHM and the NHM during the previous years, in many states what we have found that in the private hospitals, by the time, at that time it was 30,000 rupees. By the time 1 or 2 patients are treated in a private hospital, the whole amount will be spent. So they will not be able to send more patients from a family. So this kind of insurance, where the private sector fleeces the people, that if we more and more leave if the government policy is to leave more and more of our people to the private insurance policy, it will be a great disaster. Now, when we look to certain the WHO figures, it says that every year 52 lakh people die, which means there is a death one per minute in our country. And it also shows that among patients below 40 years, 1 in 6 die out of cancer or heart disease. Because of this, it is projected that during the period 2016 to, that is this year, to 2030, the total expenditure for treating non-communicable disease patients will be 6.2 trillion, that is 6.2 lakh crores of dollars, or about 42 lakh crores of rupees. Now, if you work it out per year, it will mean that we will have to spend about 2.8 lakh crores per year. It is at that It is against that we have to see what we have now we have set apart in our budget this year. It is not even 1/10 of that amount. So this is a picture. What we require, we are not spending even the 1/10 of what the WHO projects. And we find that because of the way in which we have been treating at the government hospitals, because of the lack of doctors, nurses and other employees, particularly in rural hospitals, more than 70% of our patients depend on the private hospitals. And this increases the expenditure of the public. They have, in a family, if there is a patient who has got cancer or heart disease or kidney disease, they will have to sell their house. They will have to take big loans. That picture is there, particularly in my state, Kerala. We are coming across such instances a number of times. So, in this context, we have to see that this is avoided. I have to mention two more points. One is, now we have introduced the ASHA workers to help the preventive system. We have got millions of ASHA workers in our country. Most of them are women. They are ill paid. Now, according to the present situation, even though they were introduced, this ASHA worker system was introduced only temporarily, we know now we will not be able to do it away in the course of the 10 or 20 years, which means that we should properly pay these people. There should be proper payment to the proper payment of wages to them, and also proper service conditions.
Thank you.
Another thing is that, one more point. In our medical health system, from the MCA onwards to the local hospital, everywhere we find corruption, rampant corruption. This has to be dealt with. Now, even the Supreme Court the other day had to intervene to introduce a national entrance examination, because in the vast number of private colleges, the admission itself is corrupt. So I think the government has to take a position in all these things. In the health system, we will, in the course of a few years, we will make it free of corruption. Thank you.
Thank you.